The top stories tonight and why News. 113 areas all over the country are now under localized lockdown, while President Rodrigo Duterte appeals to Filipinos to adapt to the new normal.
Findings that steroid treatment Dexamethasone has life-saving potential for critically ill COVID-19 patients give reason to celebrate, says the World Health Organization.
A research group believes that traditional jeepneys are safer against COVID-19 than modern jeepneys. Philippine Army facilities for locally stranded individuals nearing full capacity.
COVID-19 vaccine could begin human trials in October in Thailand, says an expert.
Find out the World Health Organization's newest partner in spreading safety tips against coronavirus infection. Good evening, Philippines and the world. Today is Tuesday, June 23, 2020. I am Harleen Delgado.
Join us in the next 45 minutes as we deliver today's top stories around the globe. I'm Angelo Castro III.
We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide through the UNTV News and Rescue social media accounts and our website, untvweb.com. I am William Theo.
First in the news, President Rodrigo Duterte, as he talked to Filipinos last night, appealed to people to adapt to the new normal.
Bago na talaga ang pamumuhay, ang diskarte, maglakad, paggalaw, social distancing, hugas kamay, mask, tapos, kumare, limit mo yung labas mo.
The president underscored that the COVID-19 virus is virulent when it enters the human body.
Kababayan ko, alam mo, mahal ko kayong lahat. Nadaan ko lang sa joke kasi wala tayong magawa eh. Ilang beses na dito yung warning, nakakainis na. But really, the danger is there. It's up to you to decide. Pag tinamaan ka, sorry.
Despite the relaxing of coronavirus restrictions, this is not a time to be too confident and complacent, according to President Duterte. More than 100 areas across the country are now under localized coronavirus lockdown. Meanwhile, Malacanang dares the public not to let the 40,000 COVID-19 cases prediction happen in July. Our palace correspondent, Rosa Licos, will join us tonight to tell us why live. Yes, Rosalie, good evening.
Good evening, Harleen. 113 areas in the Philippines have been placed under localized lockdown to prevent the further spread of COVID-19. 67 of those areas are in the Cordillera Administrative Region and 19 in the National Capital Region and Region 7 each. Meanwhile, according to IATF Resolution Number 48, no area in the country will be placed under a new normal classification. As the threat of COVID-19 remains in the Philippines, all places will be under community quarantine, such as enhanced community quarantine and modified enhanced community quarantine for high-risk areas, general community quarantine and modified general community quarantine for moderate risk areas, and MGCQ for low-risk classification. According to the prediction of experts from the University of the Philippines, COVID-19 cases in the Philippines may reach 40,000 in July. Malacanang hopes this will not happen and dares the public to do everything and maintain proper hygiene, stay healthy, observe social distancing, and be a homeliner to prevent the 40,000 prediction from happening. Here's the statement of Secretary Harry Roque.
And the challenge, mga kababayan, let us disprove the prediction of UP na magiging 40,000. Huwag po sana nating payagan na umabot ng 40,000 pag tapos po ng buwan ng Hunyo.
Back to you, Harleen.
Cause for that report.
City government implements a 14-day lockdown in an area with more than 200 families. Meanwhile, the City Health Office has also started conducting mass testing to the residents in the area. Here's Asher Kadapan Jr. to tell us why.
The community of Block 35 Excess Lot in Muntinlupa City started a 14-day lockdown today. The city government imposes such measure as it records a high doubling time of COVID-19 to 10 residents in the area. A city official explains the rapid spread of the contagion within the community was due to violations of health and safety protocols by some individuals.
Siguro in all LGUs, hindi na nagiging problema yung hindi pagsiseryoso ng social distancing, pagsusuot ng face mask, kaya yun ang nagiging resulta. So siguro kailangan talagang isa puso, isa isip, isa gawa. Lahat yung mga yan yung protocols.
To immediately isolate positive COVID-19 cases, the City Health Office has started conducting mass testing in the area with 219 families or 872 residents. Those who yield positive in the rapid testing are brought to the city's designated isolation facility. The city government appeals to its constituents to take the implementation of health protocols seriously, including the wearing of face masks, social distancing, hand washing, and sanitation. Asher Kadapan Jr., UNTV News and Rescue. We serve the people, we give glory to God.
Environment Secretary Roy Cimatu and other officials of the Interagency Task Force on COVID-19 met in Cebu City today. The IATF officials first found out the current situation, actions taken, and further plans that need to be done in Cebu City, just like President Duterte's order. Vice Mayor Michael Rama is confident that the rise in COVID-19 cases will be taken care of now that the President appoints Secretary Cimatu to lead the COVID-19 response in the city. Lockdown is the primary strategy to be used in parts of the city worst hit by the new coronavirus. According to Police Colonel Cedric Tamayo, officer in charge of the Cebu City Police Office, 10 areas in the city are subject to lockdown, while 8 sitios in different barangays will be monitored by police. And because of the lockdown, the local government has been the primary source of relief, like food and other necessities. Police Colonel Tamayo added there may be less lockdowns due to the increase in recoveries. According to the Cebu City Health Department's report today, the city has a total of 4,479 confirmed cases, of which 2,213 are active and 2,177 have recovered, while fatalities are at 89.
The Philippines has not yet fully attained the flattening of the curve, according to the Health Department. This is in spite of the slowing of case doubling time of COVID-19 cases in the country. Our health correspondent, Aiko Miguel, details why.
It is clear in the Department of Health's assessment that on the 100th day since community quarantine was first implemented in the country, the case doubling time has gone up to 7.26 days. The DOH says the health facilities have not reached their full capacity. There are still enough medical equipment to respond to the medical needs of COVID-19 patients, or technically speaking, the critical care utilization.
Pag tinignan natin ngayon ang ating mga numbers, 35% pa lang ang ating na-utilize out of the 100% na meron tayo. So we were able to capacitate our health system.
In spite of this, the case trend in the country manifests that the Philippines has not yet fully attained the flattening of the curve because some areas still show spike in cases, especially in Central Visayas. Flattening of the curve is an indication that the country copes more and responds better to the COVID-19 pandemic.
We are seeing spikes of cases in some of the areas in the country. So ibig sabihin, hindi po buong bansa ay overwhelmed. Nakakakita po tayo ng iba't ibang bahagi ng ating bansa ngayon na medyo kailangan bantayan because there are hotspots.
The DOH also explains one of the reasons why there are more cases reported daily is the expansion of the daily actual testing capacity, which is now at 12,000 to 13,000. The DOH is also aware that the country's health system needs to be improved for better COVID-19 response. That includes the automation of information system for a faster isolation and contact tracing, and the need for more COVID-19 licensed testing laboratories. As of today, the country has 63 licensed testing labs. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
The continent of Africa this week has surpassed the 300,000 mark of COVID-19 cases in total, according to Africa's Centers for Disease Control and Prevention. Africa, however, at this point is still avoiding the large proportion of deaths associated with the novel coronavirus. Dr. Michael Ryan, the Executive Director of WHO Health Emergencies Program, pointed out that testing is not as frequent in Africa, so there could be clearly underreporting of cases. In general, there has been a rise in cases in South Africa, with a surging number of patients. Will it follow the footsteps of Latin America as the new epicenter of the new coronavirus disease outbreak?
Will Africa be the next epicenter for this pandemic? I certainly hope not, because the health systems in Africa in general are weaker than in other parts of the world, and we need to try and keep these numbers as low as possible, while at the same time making sure that the lives and livelihoods are protected.
Meanwhile, findings that dexamethasone has life-saving potential for critically ill COVID-19 patients give reason to celebrate, the WHO says. Jovic Burmas reports why.
WHO Director General Dr. Tedros Adhanom Ghebreyesus said in WHO's regular COVID-19 briefing Monday night that the recent finding, the steroid dexamethasone, has life-saving potential for critically ill COVID-19 patients. He added that it gave the Global Health Agency a much-needed reason to celebrate. But the next challenge, he said, is to increase production rapidly and equitably distribute dexamethasone worldwide, focusing on where it's needed most. In the Philippines, the health department warns against the improper use of dexamethasone by the public. According to Health Undersecretary Maria Rosario Vergeire, dexamethasone is not a magic pill to cure COVID-19. She added that the public must be aware dexamethasone must not be easily accessed from drugstores and taken, and then hope to avoid COVID-19. In the United Kingdom, scientists have recently found that dexamethasone has shown to reduce deaths from the coronavirus. In the trial, it cut deaths by about one-third in patients who were on ventilators because of coronavirus infection. Britain has 240,000 doses of dexamethasone in stock and on order, Health Minister Matt Hancock said on June 17, while British Prime Minister Boris Johnson said last week they have taken steps to ensure they have enough supplies even in the event of a second peak. WHO has this warning on the use of the low-cost steroid treatment.
WHO emphasized that dexamethasone should only be used for patients with severe or critical disease under close clinical supervision. There is no evidence this drug works for patients with mild disease or as a preventative measure, and it could cause harm.
Jovic Burmas, UNTV News and Rescue. We serve the people. We give glory to God.
COVID-19 infection in minks on Dutch fur farms was first reported in mid-April. The mink showed symptoms ranging from runny noses to severe respiratory distress. The Netherlands has since culled more than 500,000 minks from 13 infected fur companies. In yesterday's media briefing on COVID-19, WHO confirmed that there were minks that had been found positive in the Netherlands and Denmark, and investigations find there were people who infected the minks, and in turn, some of the minks infected some people. COVID-19 technical lead Dr. Maria van Kerkhoff pointed out such transmission is limited. WHO still learning that this means in terms of transmission and what role it will play.
This is a virus that is predominantly transmitting between people through respiratory droplets, and this is the driver of transmission. This gives us some clues about which animals may be susceptible to infection, and this will help us as we learn more about the potential animal reservoir of the SARS-CoV-2 virus.
Van Kerkhove explained there's a number of ongoing studies looking at animals that are susceptible from minks, parrots, cats, dogs, to pigs.
Let's now take a closer look at the updated count of coronavirus cases around the world. The COVID-19 pandemic has now reached a total of more than 9.1 million confirmed cases in 188 countries, regions, and sovereignty. That's an increase of more than 145,000 positive cases from yesterday. The fast-spreading disease has claimed some 4,000 more lives, bringing the global death toll to over 472,000, while more than 4.5 million patients across the globe have recovered from the new coronavirus infection, meaning an addition of close to 97,000 patients from yesterday. The United States of America, the worst-hit nation, now has more than 2.3 million confirmed cases. That's an increase from yesterday's more than 31,000 reported cases. On the other hand, Brazil has the second highest death toll, next to only the USA, with now more than 51,000 death cases. Meanwhile, the country's Department of Health says that 1,150 new cases were reported today, including 361 late cases and 789 fresh ones. That number raises the total confirmed cases of coronavirus infection in the Philippines to 31,825. That is, as of 4 p.m. today. We have lost 9 more patients. But through our fervent prayers, medical interventions, and sacrifices of our medical frontliners, 299 more people have won their battle against the invisible enemy. That brings the total recoveries nationwide to 8,442. Thanks be to God.
President Rodrigo Duterte hinted that he will visit various parts of the country in the coming days. He even admitted that if there are people who hate lockdowns, he is one of them.
Alam mo, sa totoo lang, if there is anybody who wants to be out, to enjoy, and even to live life normally, ako. Ako yung ayaw talaga sa itong lockdown. I hate it. I do not want even myself. Pero ang sabi ko sa inyo, kung kayo hindi makatiis at tinamaan kayo, sorry na lang. Same is true for me. If I'm reckless enough, then I'd get it.
The president added that he understands the sentiments of Filipinos who dislike the limitations of their movements due to coronavirus lockdowns. He also revealed that one of his stops are military camps, but he will make sure to take precautions.
The Malabon Jeepney Transport Service Cooperative, a modern jeepney operator, still uses a manual system of fare collection. Majetco began operating in January but stopped due to the COVID-19 pandemic. But the group actually had a plan to go for a cashless fare collection system. Dante Amento has more details why.
Benji Limon, the vice chairman of Malabon Jeepney Transport Service Cooperative, says that if it were not for the COVID-19 crisis, they could have begun an automated fare collection system.
Actually, talagang nasa plano yon. Kaya lang, siguro kung di nag-lockdown, baka nagsisimula na kami ng cashless.
The aim for cashless payment by August. Aerosis Transport Service Cooperative or ARTSI, on the other hand, encountered glitches in the beep card system. They will have to coordinate first with the beep card company to fix the problem.
Hindi pa kami nakapag-report kay beep sir. Bali, kailangan magigipag-coordinate pa kami sa kanya.
Based on the Land Transportation Franchising and Regulatory Board or LTFRB, Memorandum Circular Number 23, cashless payment is one of the requirements for the modern jeepneys to operate in areas under general community quarantine. Failure to comply means penalties or cancellation of the Certificate of Public Convenience or Provisional Authority to Operate. Meanwhile, the elderly and persons 21 years old and below are still barred from using the public transport like the modern jeepneys.
Unang-una, bawal silang lumabas ng bahay. So, isa yun, tsaka yung mga, yung mga senior, yun naman din tamaan ng COVID.
Dexamethasone UNTV, News and Rescue. We serve the people. We give glory to God.
A research group believes that traditional jeepneys are safer against COVID-19 than modern jeepneys. Vincent Arboleda will tell us why.
The design of traditional jeepney promote air ventilation as air freely circulates throughout the vehicle, thereby ensuring a fresh supply of air that may prevent the spread of COVID-19 among passengers. As compared to a modern jeepney with an enclosed and air-conditioned structure and limited ventilation, research group Ibon Foundation believes traditional jeepney is a safer means of transport than its modern counterpart. The group based their assumption on studies published in different countries on the coronavirus disease 2019, one of which is the study published by medical researchers and physicists of the University of Amsterdam, where they found that small cough droplets potentially carrying the virus can stay in the air inside a poorly ventilated room for many minutes. Another study cited was the results of the study of air quality and health experts in Chinese Academy of Sciences, where it states that airborne transmission is a significant route of infection in indoor environments. The International Association of Public Transport also warns that public transport system is a high-risk environment due to its limited space and ventilation. Both the European Center for Disease Prevention and Control, as well as the United States Centers for Disease Control and Prevention, also issued reminders to ensure proper ventilation in public transport. Such measures are also being implemented in countries like Thailand, China, and India. That is why Ibon Foundation firmly believes that it is safer to commute with a traditional jeepney with an open air rather than ride an enclosed and air-conditioned modern jeepney.
Hindi kailanman matatapatan ng mga enclosed modern jeepneys yung sariwang hangin sa traditional jeepney. So para dun lamang, tingnan namin malaking advantage ng traditional jeepney sa mga modernized air-conditioned jeepney.
The Department of Health also gave their position on the matter.
No, ang mode of transmission is droplet infection. With aircon or without, do not wear your mask. Laki kasi ng risk pagka sa jeepneys because ang kanilang sakayan ay face-to-face eh. Hindi katulad dun sa bus na parang mga upuan na hindi kayo magkakaharap.
The Health Department also issued minimum health standards that should be implemented on the public transportation sector to prevent the spread of COVID-19. Ibon Foundation hopes the research and citations can aid jeepney operators and drivers with their talks to their respective local government units and authorities so they can go back to their livelihood. For its part, the Department of Transportation is also formulating guidelines before allowing traditional jeepneys to ply the roads of Metro Manila. Vincent Arboleda, UNTV, News and Rescue. We serve the people. We give glory to God.
The Metropolitan Manila Development Authority has apprehended a shuttle bus unit. Now, the agency reiterates that discipline among motorists is very essential on the roads. Joanano tells us why.
Aside from imposing penalties, the MMDA wants to further investigate certain shuttle services over violation of traffic rules. MMDA CCTV captured this scene in which a shuttle service vehicle owned by Ceres Bus Company is seen coming from the outer lane, blocking other private vehicles so it could enter the bus lane in the innermost lane. Military escorts who were also inside the bus got off to move the concrete barriers so they could forcibly take the busway. MMDA traffic law enforcers were able to apprehend the driver of the shuttle service who was then ticketed.
Ang nakaka-alarma dito, nasa labas na nga siya, gusto niya pa pumasok dun sa busway. Hindi na nga siya magkasya, wala naman tayong entry point doon. And yet, pinilit niyang pumasok. Ginamit niya pa yung mga military escorts niya na i-move yung barrier para magkasya siya.
The MMDA wants to further investigate the driver because of another incident that involved the same bus company in which a passenger was unloaded in the middle of EDSA yesterday.
Hindi ko alam kung kaninong instruction nila nakuha yan na pwede sila dyan sa busway natin. Hindi nga pwede. Again, may kita nyo yung mga attitude na to, nagkakagulo na tayo in as far as management. Marami na nakukumpis dyan kung ano talaga yung busway na yan, and yet these people are adding to the confusion.
The MMDA reiterates that bus lanes are exclusively for city buses. Other motorists are prohibited to ply on the dedicated lane. The agency also calls on motorists to cooperate and practice discipline on the road. Joanaro, UNTV News and Rescue. We serve the people, we give glory to God.
Meanwhile, the Davao City local government announces the launch of a unified identification card for all government officials and employees of the city. This will be used not only for attendance monitoring through the centralized biometric attendance system, but also to avail government assistance and benefits hassle-free. Davaoeños should register online using the Davaoeño app that can be downloaded with their smartphones to avail of the unified ID. Registration ends on June 30, 2020. The Bureau of Fisheries and Aquatic Resources, or BFAR, clarifies the recent fish kill in Laguna Lake was not caused by a virus. The agency also assures that fish in the market is safe to eat. One of our senior correspondents, Ray Pelayo, reports why.
The Bureau of Fisheries and Aquatic Resources, or BFAR, Region 4A reports that around 800 metric tons of fish died in the Laguna Lake last week in Pililla and Binangonan, Rizal. Region 4A Director Sammy Malvas clarifies the fish kill was due to the lowering of dissolved oxygen in the water and not of any virus.
Kalimitan po ang cause po niyan ay yung pagbabago-bagong condition, weather condition natin. Halimbawa po ay sobrang init o mainit po sa araw, tapos pagbandang pahapon po ay biglang bubuhos yung malakas na ulan. So, mayroon pong pagbabago din sa nagkukos po yun ng pagbaba ng level ng dissolved oxygen.
One of the viruses that can infect tilapia is the so-called Tilapia Lake virus, or TLV, with which an outbreak was recorded 3 years ago in Bulacan. According to Malvas, the incident has no recurrence so far, and they do laboratory testing on fish seed samples before transporting the samples to other places.
Nag-i-issue po kasi tayo ng health certificate para po doon sa transboundary movement, yung mga buhay na sinilya.
The supply of tilapia in Balintawak Market comes from Pampanga and Batangas. There has been no price increase. BFAR assures that fishes in the market are safe to eat, provided they are thoroughly cooked. Ray Pelayo, UNTV News and Rescue. We serve the people, we give glory to God.
The Philippine Army is appealing to locally stranded individuals, or LSIs, to wait for further announcements from government before going straight to their headquarters. According to Army spokesperson Colonel Ramon Zagala, the headquarters is nearing its 500 capacity for LSIs who are seeking temporary shelter while waiting for their rebooked flights back to their provinces. As of 10 in the morning, 491 locally stranded individuals have been accommodated at the Army Headquarters Complex. 305 are in Philippine Army Wellness Center, 170 at the Libingan ng mga Bayani, 9 who are pregnant are at the Army General Hospital, and 7 who are now under quarantine at the Army Grandstand.
We would like to assist everyone to go home. But at the moment, let's just wait for further announcements coming from the IATF so that they will know when they should already go to the airport or to facilities that can accommodate them.
We talked to some locally stranded individuals, and one of them is 37-year-old Mercy Bantayan, who's unable to fly to Saudi Arabia for work this year due to the lockdown. She says they have decided to wait outside the Philippine Army headquarters yesterday morning, days after they were evicted from the boarding house when their agency failed to pay their rent. Mercy says they have nowhere to go while waiting for their rescheduled flight back to her home in Davao Oriental next month.
Dito na lang kami tumuloy kasi nakita namin sa TV na ito makakatulong sa amin. Nagbakasakaling po kami na makauwi po kasi wala kaming matutuluyan po.
According to some LSIs, there is enough food supply and they have received a 2,000 peso financial aid from the Department of Social Welfare and Development. Colonel Zagala adds those who tested positive have been scheduled for RT-PCR tests. During his public address last night, President Rodrigo Duterte says League of Municipalities in the Philippines President and Narvacan Ilocos Sur Mayor Chavit Singson has offered 400 buses for the transportation of stranded individuals in Visayas and Mindanao. Meanwhile, Defense Secretary Delfin Lorenzana estimates up to 40,000 individuals are locally stranded in Metro Manila. He further appeals to locally stranded individuals not to flock to airports without confirmed flights. The Department of Health Western Visayas considers a 5-year-old child from Mandurriao, Iloilo to be the youngest COVID-19 patient. The child is patient W-V189 according to the DOH case bulletin. The patient is among the 15 locally stranded individuals who have tested positive for COVID-19. He has asymptomatic symptoms and is currently staying in a local quarantine facility. Jago and William, we are on board the UNTV radio mobile booth and we are here in Commonwealth Avenue in Batasan Hills, Quezon City. Let's take a look at the situation on the road. To motorists going to Fairview plying the Commonwealth Avenue, we are seeing a light to moderate traffic flow here in our area. Meanwhile, we'll also have a light traffic on the other side of the road going to Elliptical Road to EDSA Quezon Avenue. And for our weather update. The easterlies is affecting parts of the country. State Weather Bureau Pag-asa says the weather condition is affecting the eastern sections of Visayas and Mindanao. Meanwhile, Metro Manila and the rest of the country may experience partly cloudy to cloudy skies with isolated rain showers due to the easterlies or localized thunderstorms. Pag-asa adds possible flash floods or landslides may occur during severe thunderstorms.
Best House of Chicken in Apalit has recently opened, making sure to follow the IATF protocols for restaurants. But good news to Metro Manila chicken lovers, your long wait is over. Here's why from Mon Hokson.
Have you been craving for delicious and juicy chicken? Worry no more, because your favorite Best House of Chicken in Quezon City reopens its doors. You now have the chance to taste its crispy house blend chicken, herb roasted chicken, and other delicious foods that HOC offers. To observe safety and health measures, HOC accepts takeout and delivery orders only. For all customers who want to visit the Eton Centris branch, you will need to fill out a form. This will help authorities fast-track contact tracing in case there is a need to carry out the process.
Health checklist namin na pinoprovide po para at least ma-trace po natin kung yung history ng customer na papasok dito.
Customers must disinfect their footwear using a foot bath, apply alcohol, rub on hands, and have their body temperature checked before entering the store. A partition wall in the order area has been installed to prevent direct physical contact among customers. There is a dedicated payment window where payments and cash change are also disinfected. Customers waiting for their orders can sit in the waiting area. The chairs are arranged with 2 meters distance apart. orders for claiming will be placed at the pickup window near the exit.
Mula sa pagpasok hanggang sa pagbabayad mo, pag-claim mo ng change, pati ng orders mo, okay po. Talagang safe talaga. Both sa customer at saka dun sa nag-a-assist po ng food.
HOC delivery crew also follow health protocols. All staff members inside the HOC have undergone a 14-day quarantine to ensure they are not carriers of the deadly coronavirus. The store is disinfected once a week in compliance with Eton Centris management's guidelines. House of Chicken Eton Centris is open from 11 a.m. to 7 p.m. daily. For delivery orders, just contact Ian Busque through cell phone numbers 0905-413-3161. Mon Hokson, UNTV News and Rescue. We serve the people, we give glory to God.
President Duterte's remarks in defense of Health Secretary Francisco Duque III will not affect the investigation of the Office of the Ombudsman on the health chief. According to Malacanang, Aiko Miguel explains why.
Presidential spokesperson Secretary Harry Roque in an interview explained why the chief executive still trusts Secretary Duque in spite of allegations.
Tuloy pa rin ang investigasyon, kaya nga sabi po ni Presidente, with all due respects to Ombudsman Martires, no, alam po niya na independyente at constitutional office ang Ombudsman at hindi po niya hinahadlangan ang investigasyon nito. Ang sinasabi lang niya, kampante siya na lahat ng tauhan niya sa gabinete ay mapagkakatiwalaan.
Secretary Duque grabbed the chance the President gave last night to defend his side. He said the distribution of health workers' benefits was delayed but the 1 million peso compensation each for the 32 bereaved families of the healthcare workers who died from COVID-19 have been distributed. Even the 100,000 pesos benefit for the healthcare workers severely ill due to coronavirus infection. Secretary Duque also clarifies it is not true the DOH has not done anything in the procurement of the personal protective equipment for frontline healthcare workers. He also explained there's a global shortage why the procurement of PPE and medical gears for frontliners had a delay. Secretary Duque added even PAGCO released 1.8 billion pesos for the procurement of 1 million PPEs last March. President Duterte supported Secretary Duque's statement that the country looked for ways to procure affordable equipment and medical gears needed for the country's COVID-19 response. According to the President, he vouches for Secretary Duque because he's certain there are no anomalies in the DOH.
Naghanap pa tayo kung saan tayo makabili ng mura at maraming supply. I am very sure and I place my reputation sa kang Secretary Duque nga walay kawat nga nahimo na.
Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
The Senate building has been placed under semi-lockdown after 2 of its employees tested positive for COVID-19. Senate President Vicente Soto III says they cannot declare a total lockdown as there are hearings and work to be conducted by Senator's office. He adds the persons exposed to the 2 COVID-19 positive employees have already satisfied their 14-day self-quarantine. Senate Medical and Dental Bureau records 16 COVID-19 cases since March with 2 active cases, 13 recoveries, and 1 death. Senator Soto adds the Senate will shoulder the cost of COVID-19 testing of its employees who are also entitled to health benefits.
And for the news abroad, here's Kath Dumaraos live from Bangkok, Thailand. Good evening, Kath.
Good evening, William, and to Diego and Harleen. How are you?
Yes, I'm fine, Kath. How are you doing? And what have you got for us tonight?
Yes, William, I am doing fine, and the government here in Thailand hopes that a vaccine being developed against the coronavirus disease could begin human trials this October. And later, I will tell you why the government of Shanghai in China is gathering samples from fish and meat products in large markets, and why provincial officials in Pakistan's southeastern Sindh province say that migratory birds are flocking to wetlands in greater numbers during the lockdown.
Okay, go ahead, Kath. Please tell us why.
Suet Meshinsi, Minister of Higher Education, Science, Research and Innovation, said that after the first injections on monkeys on May 23rd using an mRNA type of vaccine, the monkeys remained healthy and suffered no side effects. Meshinsi said a second round of animal trials would be in August, and if successful, it would lead to human trials in October. The vaccine is being jointly developed by experts from Chulalongkorn University's Center of Excellence in Vaccine Research and Development, the National Vaccine Institute, and the Department of Medical Sciences. Now, on its 29th consecutive day of zero local transmission, the government reported 5 new imported cases from quarantined returnees from the Middle East today, taking the total number of infections in Thailand to 3,156. 3,023 of those patients have recovered, though 58 have died since January and 75 remain in hospitals. Thailand has a 95.8% recovery rate. South Korean capital Seoul's mayor warns if recent infection rates continued, the city could see hundreds of cases a day soon.
If Seoul is infiltrated by the virus, the entire Republic of Korea will be infiltrated. If the metropolitan areas are infiltrated, all the efforts made so far will have gone to waste.
Mayor Park cited experts that if the R value, or the reproduction number which shows a disease's ability to spread, remains at the level that it was 10 days ago, they expect that the daily number of confirmed cases will be around 800 in a month.
If we continue down this road, we are just 1 month away from a second pandemic.
He added, there is a chance the country has to go back to strict social distancing. Yesterday, South Korean health authorities for the first time said the country is battling a second wave of coronavirus infections stemming from a holiday in May. South Korea today added 46 cases, with 6 recorded in Seoul, reporting a total of 12,484, according to the Korea Centers for Disease Control and Prevention. Elsewhere in China, Shanghai is carrying out massive nucleic acid testing in its major online and offline markets as an effort to curb COVID-19 and protect people's safety. Laboratory technicians clad in protective suits collected samples of frozen meats and seafood products. They also gathered samples from staff members' hands, gloves, aprons, and working clothes. At outdoor markets, technicians examined not only food, but also tools, product packages, and stall owners. The massive testing started on June 16 and will continue to July 16. As of Monday, all test results are negative. Texas Governor Greg Abbott on Monday said the rising rate of COVID-19 cases and hospitalizations is unacceptable, but said he has no plans to shut down the state again. Texas broke its record for COVID-19 hospitalizations for the 11th day in a row, with state officials reporting 3,711 patients in Texas hospitals Monday.
I've said all along that if the positivity rate or the hospitalization rate increase too much, we have strategies to reduce the spread of COVID-19 without having to return to stay-at-home policies.
Texas, as of today, has more than 114,000 confirmed cases, 2,192 fatalities, and an estimate of 69,000 recoveries. Texas has the 5th highest count of coronavirus cases in the USA. Meanwhile, some refreshing news from nature. Provincial officials in Pakistan's southeastern Sindh province say that migratory birds are flocking to wetlands in greater numbers amid lockdown measures that have kept hunters and bird catchers confined to their homes. Each year, more than 1 million birds stop in Pakistan en route from Siberia to India. Among them, pelicans, mallards, cranes, and waders. Veteran wildlife photographer Amir Ali Rizvi says coronavirus measures have helped the birds settle in. Each year, approximately 40% of Sindh's wetlands are surveyed to gain insight into the migratory patterns and numbers of birds. Pakistan has been fluctuating between various lockdown measures since March in an effort to contain the coronavirus. Mahar said he could not pinpoint the exact reason for the change in numbers, but the fact the birds are staying in the area longer than usual could be attributed to
the illegal trade in the domestic markets. It's no more. Well, for speaking illegal huntings, there is not a single event during these lockdowns we have recorded.
Thank you very much, Kath Damaraos, reporting live from Bangkok, Thailand.
In tennis, Croatia's Borna Coric, who played in Novak Djokovic's Adria Tour exhibition tournament at the weekend, said on Monday he had tested positive for COVID-19. Coric's positive test follows that of Grigor Dimitrov, who said on Sunday he had contracted the novel coronavirus. Organizers of other sports looking to resume from the coronavirus shutdown will be watching developments with some trepidation as they try to find the safest way of getting competition back underway. Coric, ranked number 33 in the world, revealed on Twitter that he had tested positive for COVID-19. He says he wants to make sure anyone who has been in contact with him during the last few days get tested. He also apologizes for any harm he might have caused. He's feeling well and doesn't have any symptoms. It's not just Gru and his cute minions who are up for the mission to spread the word of keeping safe in this time when the novel coronavirus continues to spread across the 188 countries, territories, and sovereignty. Even the childish Mr. Bean uses his unusual wit to play his part in this battle against the invisible enemy using a checklist. Here's why from Nina Armilio.
The World Health Organization, or WHO, has a new partner in spreading the news of keeping safe in this time of the novel coronavirus pandemic. Comedy cartoon star Mr. Bean is not allowing himself to be left behind in the fight. Through a new public service announcement, or PSA, Mr. Bean reminds people about the importance of washing hands, physical distancing, and most importantly, showing kindness. This is made possible through the joint hands of WHO, Project Everyone, and Tiger Aspect Productions in Great Britain. Mr. Bean's essential tips to protect people against COVID-19 are keeping the hands clean while avoiding touching the face, keeping at least a 1 meter safe distance, keeping in touch with neighbors and friends, keeping an eye on symptoms, and following the doctor's advice. The PSA is voiced by actor Rowan Atkinson himself. Nina Armilio, UNTV, News and Rescue. We serve the people. We give glory to God.
Those are the reasons behind the news, June 23, 2020. I am Harleen Delgado. We serve the people. We give glory to God.
Reasons we deliver to you as they unfold. I'm Angelo Castro III.
And I am William Theo. Because we need to know, we will always ask why. Have a great evening and stay safe, everyone.